to the puzzle. It's not solving everything, but it is a piece to the puzzle.
A new program in Knoxville aims to reduce the spread of disease and curb the overdose epidemic. The Syringe Service Program allows drug users to exchange dirty syringes used to get high for clean ones, all anonymously and all free.
There are 3 such exchange programs around the state: Nashville, Chattanooga, and Knoxville. Supporters say it helps stop the spread of diseases like HIV and hepatitis C and helps get treatment for people addicted to drugs.
Now, critics argue the program encourages users to continue getting high. 10 News reporter Mark Salinger takes us inside the program to see how it works. Mark.
Robert and John, the Tennessee Department of Health says syringe service programs reduce overdose deaths, save healthcare costs, and reduce drug use. Here in Knoxville, the program has already seen more than 200 participants in just the first 3 months.
From outside, it's nondescript.
There we go.
An empty white van on the front lines of the overdose epidemic.
Talk to them about treatment options, if they've thought more about it, how many syringes maybe they've used this week.
Once a week for 3 hours, the Project Act van pulls up to a street corner in Knoxville with a bed full of clean syringes and the goal of helping addicts get treatment.
What we're trying to do is just reduce the risk of HIV and hepatitis C.
The program gives drug users free clean syringes in exchange for dirty used ones. But advocates say it's much more than that.
This is a group of people that largely are not in any kind of medical care. And if this is their foot in the door, if this is access to care, it's a start.
Operating just once a week by word of mouth, Project ACT has already seen more than 220 participants since it started in March.
Just during those 3 hours once a week, we have seen huge success.
These are 30 gauge shortened needles that clients use to inject their drugs.
Down in Chattanooga,
The only way they get needles is if I get them back. I want the dirty ones.
the Syringe Trade and Education Program has already given out more than 12,000 clean syringes and taken back 8,000 in its first 3 months of operation.
I feel this is the same concept as condom distribution. You know, kids are gonna do it anyway. Addicts are gonna do it anyway. And that it's best to give them that opportunity to do it at least safely.
Along with the clean syringes, participants get tools to more safely inject drugs like heroin and meth, including the overdose reversal drug naloxone.
Biohazard containers, as well as there's tourniquets, alcohol pads, filters.
The Tennessee Department of Health says people who inject drugs are 5 times more likely to enter treatment for substance use disorder when participating in a syringe exchange program.
Each time you come in contact with them, you're planting a seed with that person that we're going to help you if you want to stop using.
There are syringe exchange programs in 20 states and 194 cities across the country. Last year, state legislators passed a law allowing Tennessee programs to receive federal funding, but would require them to use private grant money to buy the actual syringes. Since August 2017, 90,000 syringes have been distributed across the state. 24,500 have been returned.
There'll be less chance of seeing syringes, being discarded in parks, place where your kids are playing. Law enforcement, first responders will have less opportunity to have occupational exposure.
For law enforcement around the state,
I can see the benefits of it reducing the potential increase or the risk associated with developing HIV, Hep C or Hep B.
Agents see both the positive and the negative effects.
The other side is, unfortunately, you don't want it to encourage use.
It's going to take a while, I think, to build a relationship with someone who may not feel comfortable or safe bringing used syringes back. But we've seen week after week that the numbers that people are bringing back, it continues to increase.
As Knoxville continues to see people die every day from drug overdoses, advocates hope this program may provide a lifeline to those desperate to get their next high.
This is a piece to the puzzle. It's not solving everything, but it is a piece to the puzzle.
And Project ACT hopes to operate the syringe exchange program multiple days a week for longer hours within the upcoming months. They also hope to expand their services to more rural counties. Robin and John.
Mark Salinger on the story, and already this year, 155 people have died from a suspected overdose death in Knox County alone. That includes 2 so far this month. In all of last year, there were 294.